Deanna, there's nothing. No citizen input. So then we will move to the COVID update and we'll leave Cindy take it over from here.
All right. Good morning, everybody. Good morning, Cindy. All right, let's try that again. We're in a pretty positive state for the county. Things are looking okay for us right now. We've had negative, should I say that? A good looking. So we are averaging, our numbers are fairly low right now. And I think you all got the report on Friday, but we had 2 active cases. We've been around somewhere between 2 and 5 for the last several weeks. We have 2,684 positives overall in this county. And we have had 35 deaths, but we have not had a death in several months now, which is another good thing. No hospitalizations at this time. Our vaccination rates are slowly climbing. We remain quite low. We're today at 41.2%. We're probably in the bottom 1/3 of the state of Wisconsin for vaccination rates. We continue to offer them every week. Typically on Tuesdays and Thursdays within our office, we have Pfizer clinics running downstairs. Last week, we were out at the Kewaunee County Fair, did a few vaccinations there. We will be offering it at our back to school program, which is coming up in August. So we have opportunities to do vaccines in bigger settings, but as of right now, it's just a slow uptick that we're seeing. I think a lot of what we're seeing right now are younger kids. So but the 2 to 18-year-olds that are coming into the clinics. So we're getting some of that population done. And it's very likely that you will see kids under 12 approved before the end of the summer, and that may increase our vaccination rates as well. Does anyone have any questions for COVID?
Channel 11 doesn't have anything good to say about Kewaunee County. Did you see their segment on the news?
Did not.
Okay.
They did not contact me, so.
Oh, they were at the fair, doing their stories, and they interviewed somebody that had COVID back in fall and did get the vaccinations. And he, at the end of the story, it says everybody should do their part, but they did show Kewaunee County where most of it is white.
Yeah.
And they did have the 41.2% on there, but they say that's common in rural areas.
Well, I think they're probably comparing us to our neighboring counties. And if you do that overall as a state, we're at 50.7%, but Brown right now is at 50.5%. Dorr is at 66% vaccinated. Manitowoc is at 47%. So we sit kind of by ourselves in this low category. We were happy last week to finally get up in the 40s because we had been sitting lower than that. So
somebody else on TV also said, well, we can't get vaccinated because we work during the day and by nighttime everything is closed up. So
we do have options for them outside of the county to do, and I can tell you that our office makes a lot of exceptions. So if there's someone that truly wants a vaccine and needs it, we can make exceptions to get it to them. We are still going out to businesses. We're still going out on the farms. We are trying to reach everyone that we can that calls and asks. And then we do have, partnerships with Bellin and Prevea and things like that. So we can refer them to other agencies that are vaccinating at different times of day.
And with Kewaunee County's population of 20 plus, that includes everybody from 0 to 100, the
Right.
population rate. So the population rate that could be vaccinated is what?
There is approximately 14% of the county that cannot receive a vaccine due to their age. So that would be people under the age of 12. And the other thing is Johnson & Johnson's no longer available for any county to order right now. So people have to be willing to accept a 2-dose series to get vaccinated because Johnson & Johnson has been unavailable. I'm looking at Deanne for several weeks. I would say 3 to 4 weeks now that we haven't been able to order that vaccine anymore.
Cindy, do you have trouble with people not coming back for the second shot?
We actually don't. We're probably at above 95% return rate. So we really see most people coming back. And to be truthful, most people ask for Pfizer. It's the vaccine of choice, I think, out there, and people have been very happy with it, and it has a good success rate right now. But for those people that truly want only one shot, Johnson & Johnson's not available.
And now Pfizer's talking about a booster.
The booster is based on a variant. So they're talking about the Delta variant. It's been out in the media recently. And that vaccine that they're talking about as a booster has not even been created yet. It will be a different makeup than what their current one is. Their current vaccine right now is covering all variants. So I'm not entirely sure what the thought process is behind that new vaccine that they have discussed. As far as what we have been told through the Department of Health, through the CDC, our vaccine is covering all of those variants, and they're very happy with where they're at right now. And the CDC and the FDA have not said that there will be a booster.
What about a third shot?
That's what we were talking about. So CDC, FDA, they are not saying that right now.
Cindy, what is there any discussion about doing free antibody testing? And if there's a large demographic in the country that they suspect have had the virus and would have antibodies, wouldn't that number want to be known?
Sure, I agree with you on that, but they are not discussing antibody testing right now.
I mean, it's just not even on.
It's not on the table. No.
What are we looking at for our kids this fall? Are we looking at going to masking? Are we looking at all the social distancing and all that sort of thing?
So we have a few preliminary meetings set up with the school districts. And most of them, I believe right now, are at a mask optional. I haven't heard from Algoma. So the last I heard from Algoma was that they were planning 2 masks. Kewaunee and Luxembourg Casco have or are on the route to go mask optional. They will continue to do the social distancing and things in the schools. The things that we're going to be discussing with them is how to proceed forward in as safe of a manner as possible with, doing the social distancing and things, and then really having them understand that as far as isolation and quarantine, that is issued due to our state statute authority. And that's not really something that the schools can alter as far as, we're going to choose not to quarantine. That's not an option. The quarantine will come down from the health department. They can choose, I don't know if you guys remember, WIAA had recommended not to follow a shortened version of quarantine for close contacts. We discussed that last year, where after their 6th or 7th day, they can go get tested. And if they're negative, they could shorten their quarantine with symptom monitoring. I think the schools may look at choosing to do that route because that is open as their option. So we'll see if they choose to change their quarantine in that regard, but to say no quarantine will not be an option.
I don't want to go too in depth into all the what ifs, but when we're talking quarantine, obviously that's a really bad word, and most people don't like the idea that they have to quarantine. It's like my kids at school and I got to work, the husband's got to work, and now we're all going to have to quarantine. What's the protocol? Are we going to be able to have people get an antibody test to say, look, I've already been infected. I'm not at risk. I'm not at risk to anyone else. I should not.
You
have to
can get
quarantine.
vaccinated and fall in that category, where if you're a vaccinated person who's exposed to a positive case, you do not have to quarantine. But right now that antibody test is off the table. They don't look at the antibodies. So that's where they're at. And as far as that quarantine, I think, we've only heard it talked about in great detail, obviously, with COVID, because COVID has been front and center for a year and a half. But we do quarantine other diseases. So it's not something uncommon to the health department to say, oh, you need to stay home and your family needs to stay in for the next so many days based on what illness it is. We do it for pertussis, you do it for measles, you do it for, there's different quarantines that are issued based on different diseases that are out there. Unfortunately, COVID has taken front and center, and it's a long quarantine right now.
Virginia.
I've got a question about the counts. Like, I had my vaccine done out of Kewaunee County. And my father went to like the VA clinic. Do we get those numbers? So we really
Yes.
know how many?
Yep. Every vaccine is based on place of residency. So it comes back to our county numbers. Yep. Any other COVID questions? All right.
Okay, then we are going to move on, Cindy, still we're going to do the May report and then want to follow with the June report,
Sure.
Cindy, both of them together.
Yep, you bet. So because we didn't have a meeting last month, we have two reports in front of us. What you can see is that our WIC contract caseloads are staying fairly steady. We're right around 206 to 210. Our immunizations for May were a bit higher at 527. They've dropped down for the month of June to 203. Like I said, we're getting less requests for vaccines, but it's kind of a slow, steady thing that we're doing. Communicable diseases have also dropped. So in May, you can see that we had 887 reported to us. And in June, it was 232. So things are getting a little bit better in that regard. Any questions as far as the visits or the meetings and conferences and activities that we would have taken part in?
How is your program with the
Aging and
Yes,
Pals.
thank
I
you.
will keep that. I have that on my
Okay,
list for
okay.
agency updates. So we'll give you that update in just a minute. Anything else on these monthly reports? Okay. Then if you want, I can swing right into that agency update, which I think is next. So as far as PALS, which is the senior exercise program that we're running right now for people who are more sedentary and need help getting up, moving, doing a few things, doing some strengthening. It's going well. We have a small number in this class right now, but they're thoroughly enjoying it. We're doing it out at the Kewaunee Fitness Center, and we'll be running a second session this fall that actually starts August 23rd. So we're happy to see that we have an interest in it. We've reached out to some of our clinics in the area, to their physical therapy departments, some of our medical providers, so that they can encourage their patients maybe who need recovery after something, say like a stroke or certain kind of surgery, that they can join in on that as well. And Jess is really getting some good responses from that. In addition, she's also going to be doing a virtual class, which I think is kind of nice. She's going to do, I think it's 4 or 5 sessions. It's called Stand Up, Move More. And that is going to be running in September. It will go online with Jess. So you can, right from the comfort of your home, do some exercises that will help with some of that activity as well. And that's geared more towards seniors too. In addition, we've done some summer school programming this summer, which was nice for our department to kind of get back into a normal routine. So what we did was we had a babysitting class that ran through the Kewaunee School District for a week. And we had, I believe, about 25, how many? 21 students that took part in that one. And then we ran a cooking class at both Luxembourg, Casco, and Algoma for a full week. And we had some really good participation there. I think they had like between 20 and 25 in each of those classes as well. So what we are able to do with that class, or that summer class, is encourage some of our community health improvement plan to our younger kids. So we're encouraging healthy eating and exercise. And with the babysitting, we take some of our lessons from preparedness, and we're able to put them in that as well and teach them how to be prepared to be alone. So those were all quite successful. As of August 11th, we will be running the back to school program. Our donations and fundraising are going very well. We've had some large donations come in to the office, so we're happy to see that. And we already have just how many people are registered? I'm looking at Deanne. She runs this one. So, okay, so about 111 kids have pre-registered already. And we continue to advertise for that one. It will be held down at Lake Haven Hall for the day. We're going to run it similar to what we did last year, where we're doing a little bit more of the social distancing and being COVID conscious down there. We're pre-packing some of those bags in a different manner than what we used to make it a little bit easier for families. In front of you, you have the bingo challenge. This is Rachel Bauer's way of encouraging all of you to take part in it. So we have that going on for our nutrition and physical activity work group. And that is going to be starting August 1st and run through the month of August. And we had a really good participation rate with our last one that we ran midwinter. So we're hoping to have even better participation with the summer and the better weather and people being able to get outside. What they've done is gone to area businesses and things and picked up donations and or gift cards so that we can also encourage our local businesses as door prizes for the bingo challenge. With that nutrition and physical activity work group, we also have been working on getting some bike fix-it stations put on our Anapee Trail. So we're looking at having 4 to 6 of those built. We have some Eagle Scouts that have taken that on as a project. And so we're just waiting for them to get final approval on a few things through the scouting organizations. And then we're hoping to have those bike fix-it stations up. And we're partnering with Dave Meyer from Park and Promotion on that program. We're also hoping to do some trail walks this fall. So we're hoping to get some of our community residents out walking the trails again. We've done it in the past. Last year, we kind of had to halt that because of COVID and fall got kind of ugly around here, but we're hoping to get that up and running again for September and October this year. And then finally in that program with the nutrition and physical activity, one of our goals was to survey restaurants to see if we could maybe alter some of the menus around here to be a little bit more health conscious. We tend to have a lot of bar food in Kewaunee County and not quite so many healthy options. So Jared, who is in the back of the room, if anyone saw him sitting there, he's my student intern from UW-Milwaukee for the summer. And one of the things that he has been working on is surveying people to see what they would like as healthy options and see how they feel about our restaurant options right now. So he's gathering some of that information, and then we're hoping to take that back to the restaurants within the next couple of months. So the other thing that Jared is working on, and I'm going to switch just a little bit, is our community health improvement plan. Every 5 years, local health departments are required to do a community health assessment. Ours was due in 2020. We were excused from it because of COVID, as were most counties in the state. But we're back to working on it this year. And what we do with that is we gather a lot of data on all different health aspects of our community. And then we bring together a group from the community to look at that data and see what they feel are the most pressing issues that we have within Kewaunee County. We vote on them, and then we develop our community health improvement plan. So that's why you often hear me talk about alcohol and drugs, mental health, physical activity and nutrition, because those are our current focuses. Jared has signed on for the summer to do that data research for us. So he has had some long hours sitting in that office doing a lot of very deep research for us. And he's putting together that community health assessment so that we can share that data with our community residents, hopefully this fall.
Welcome.
On another staffing note, so Jared joined us for the summer and we lost Sydney officially last Friday was her last day. So Sydney was one of our contact tracers that started out as a Bellin College of Nursing student and then stayed on with us for a full year. And she is now moving to the Veterans Hospital in Milwaukee. for a nurse residency program. So we're pretty excited about that for her. Wellness cooking demonstrations will be starting this week in the health department. So we have reached out to our staff and offered some cooking demos that will take place on Wednesdays every couple of weeks. The staff can pay a small fee, and then they can come in over their lunch hour and watch Jess do the cooking demo, try the food, and then leave with the ingredients to take home that night for supper. So it's a new program that we're starting, and it actually goes live this week. So she's gonna give it a whirl on Wednesday, but we've got a lot of people interested in it. Cooking demos have been pretty popular in the past, and it's part of our wellness program that we're trying to move forward with. And then finally, just so you know, probably within the next month, the budget process starts. So the health department will be going over budgeting again. Typically, we get those numbers around the 1st of August, and they have to be back before the end of August. And so I know last year there were some questions as to, do we share the budget with our committees before it goes to finance? And it doesn't necessarily fall that way with the deadlines that we get from the finance department. But I will certainly put the budget on for September, just so that you can go through what I've put together and review it and ask any questions that you might have. The health department is sitting in a little bit of a different position than we would be once again due to COVID. We have a fair amount of money that will be with us through October of 2022. And so that puts us in a slightly different position.
So you'll work on it for August, but it'll be after our August meeting. So
Yeah.
then you'll be able to present it in September.
We first get it like August 1st, and then it's due before Labor Day. Actually, we had 3 weeks last year to put it together, which is kind of a tight time frame. So what I will do though is bring it to you in September so that you can see the numbers that were brought to finance. Anyone have any questions on anything going on in our agency? All right.
You want to move Cindy to the financial report?
You betcha. So you have 2 financial reports in front of you, both April and May. And the things that I can tell you are that you will see less spending on the county levy tax dollars, simply because we have a fair amount of grant dollars coming to us this year. So we are using our grant dollars up and our COVID money for a lot of our positions right now, and not so much that county tax levy. So there will be a portion of money coming back from the health department at the end of the year that we will not
Now,
use.
you said October, that COVID money has to be used up.
Of next year.
Oh, of next year, 22.
Yeah, so we have it through 2022.
Okay.
So I can tell you that we received CARES money January 1st, and some of it went through the end of June. And then, and it's based on epidemiology. And we got one pot then, and then we got a larger pot starting in June that opens up through that October of 2022. So in excess, it's over $355,000 that's available to Kewaunee County for epidemiology and COVID-related practices. With things slowing down, I don't know how much of that we will go through, because we don't get the lump sum. We have to bill what we use. So it's different from other grants. You know, most of our grants, they tell us we're going to get 10,000. We can use that full amount. These CARE dollars, you bill what you are using, and then they refund or reimburse you that. So it's a little bit different, but right now we do have for sure 1.5, sometimes closer to 2 full-time equivalents pulling from that money right now. And then all of our contact tracing and all of our vaccine efforts and things like that too as well. Other than that, the children and youth grant was spent down by the end of May. And oh yeah. And then our preparedness grant runs on a different cycle as well. So that one was done at the end of June, which isn't fully on here yet for you. So there was a little bit left in that May pot of money, but that one will be spent down in entirety as well. So you'll see that reflected on the next financial report that you get. And then that grant runs June to June every year.
So just looking at the COVID line items and for like salaries and wages, so is that line item that's over budget on wages and salary, is that money then that'll be reimbursed? So we're dumping a lot into that. Is that
Yeah,
fine?
so I think how it works here is that it always looks opposite of the other grants because it is billed for and not sitting there already. So you're not subtracting from it. So it looks a little bit different on here, but yeah, 100% of that will be covered by the state or by the feds. Yep. Any other financial questions? All right.
Okay, then we will move to travel request
We have no travel requests.
overtime.
Overtime, we have had minimal overtime. I have one contact tracer, which was Sydney, that was working weekends for us, and she was putting in about 2 hours every Saturday. And other than that, we really haven't seen a whole lot of overtime, with the exception of possibly a vaccine clinic that runs over a little bit. So it's minimal, and all overtime is being taken out of the COVID funding.
Anything on that? Otherwise, we'll move to the next meeting, which I don't believe, because we did not have a June meeting.
I don't think it's
We
set.
did not have anything set at that point.
Right.
So August, we're looking at August 9th. August 9th, or if you just want to move to August 16th, if we would want to talk about anything on the budget, Cindy, would that be a good idea? Because that would give you a little bit of time if there are questions out there. I know like last year, there was questions.
That's entirely up to you guys, whichever you prefer.
What would you prefer? August 9th? Or we push it out a week and go August 16th if you have any questions on the budget? I know last year that was a big thing about the budget. This gives Cindy some time because August 9th, you only have really a week. If she gets at the beginning, go to August 16th, that gives you. Okay. Anybody else?
Oh.
Like consistency with our.
Yep,
Sure.
that's fine. I'm just putting it out
I
there.
mean, I know you're right, the budget was a big thing.
Big thing
Well,
last year.
We'll see
so-
what kind of magic I can pull together in a week.
Okay. Then we will go with August 9th. And we'll do 8:30. Is that okay with everyone? Do we want to go ahead with the, we always do 2 in advance. I'm sorry, did I say August 8th? I meant August 9th.
9th.
I did say 9th, okay. Do we want to go ahead to the September one right away? That would be September 13th. Is that okay? Then we'll go September 13th at 8:30. Okay, we have those down. Correct, September 13th and August 9th. Is that okay with you, Linda? Okay,
The 6th was Labor Day anyway.
yep,
Yeah,
yep.
right.
Is that good? All right, then, is there any other matters?
Can I mention one more
Yes.
thing? So you all have a handout in front of you that says the process by which local health departments conduct communicable disease investigation. And I wanted to share that with you. So I was asked to put together something explaining how I do that because of a recent news article that went out in regard to water quality. And so I put together the front page explaining how our office does communicable disease. And then I also shared with you our annual report, communicable disease numbers from the last 5 to 6 years, so that you could see where that data was that I pulled it in case you have any questions. Land and Water had requested this. And so therefore they are getting it tomorrow at their committee meeting. And so I wanted to make sure that I shared the same information with all of you in case you had any questions.
With that news article, Cindy, I believe you were us trying to assist in that matter, but denied access, correct?
I was contacted by the investigative reporter in regard to my numbers. We had probably a 35 to 45-minute long talk, and basically nothing that I shared was put into the article. Yes. So that's why I just felt like I needed to at least explain where my numbers come from, because part of the article referred to that there may be a lack of us reporting communicable disease or a lack of us following up on communicable disease. And that's not the case. Any communicable disease, whether it be a category 1, 2, or 3, by state statute has to be reported to a local health department. And the local health department has anywhere from 24 hours to 72 hours to do their follow-up, or at least try to make contact, because sometimes it's difficult to get a hold of people when you get a disease reported to you. But we do follow up on every single one of those. And so I really wanted to share that with you. And the numbers that came out in that article are a little frustrating for the health department, because A, it makes it look like we're not doing our job. And B, it's a theory, it's a prediction. But yet we've taken several calls in our office saying, well, you have, all these diseases that you're not reporting. No, that's not the case. We're reported from our labs and from our hospitals and from our clinics, every one of those diseases, and we do a thorough investigation on every one of those diseases. And I just need for all of you to understand that. And you do receive our annual reports every year. So you get those communicable disease numbers put in front of you. And so you'll see that I took those pages from 2015 to 2020. And that's the information that I'm sharing with you, is that we don't have 300 acute gastrointestinal diseases coming out of our county. I just wanted to share the facts with you versus what this prediction was in this article. And like I said, I've had several people through the community contact me, and then I did have Land and Water contact me. And so when I put together this top page, I wanted to make sure that my committee has the ability to answer the same way that Land and Water will, with what the local health department does and how we follow up on them.
And I believe in that article too. There were a lot of statements that were false or critiqued, not done in the right way, just like you with the media saying that Kewaunee County isn't following, with their vaccines. Our health department has been on top of things. I think the media is just not, they want to report what they want to report, and they leave out all the other little information that is probably very important, and put the false stuff in or slight information. So, and I do believe in that case with that front page that you actually assisted in that and was told denied access on the property. So,
Yeah.
and that was not reported in there. So the health department did follow through, but was told to leave. Denied, how do I just want to say it? Just information that was not put out to the public. So.
Yeah, that particular article was written about a specific property. Public Health, Land and Water, Wisconsin DNR, and the EPA all offered assistance on that. All were turned away.
Oh.
So, so, it was a very one-sided article, unfortunately, but just back to this. Now, how we do our communicable disease follow-up. I talk about it all the time, and I share diseases with you, but I wanted you to be sure that, we are following up on every one of those. And for a GI illness, our investigations are quite lengthy. We spend probably at least 45 minutes discussing every aspect of things that you can imagine, from diet to environmental exposures to water, to it's family exposures, hand washing, there's a lot of things that go into it. So it's a lengthy process.
Where do they get the numbers from? If you were denied access, the DNR was denied access, the EPA was.
In that
denied
article, for as
access?
far as the article was, a lot of the testing was done on surface water and not on groundwater.
But who's doing it then? I mean, where are the numbers coming from if none of these organizations that I recognize?
I don't know. They must have found a private lab or something. I'm not sure, but I know that it wasn't done through any of us.
Okay, because I mean, when you read the article, I guess that's not stated, but that's kind of what you assume
Mhm.
is that this was some government agency, and that's not correct.
No,
Sounds like creative writing.
they were encouraged to do their testing through one of us so that we could, when we start that process with like brown water, and probably all of you are aware that we have an ordinance on that. So when we have a brown water event that takes place, we encourage them to get the testing done. And then that testing, depending on what it shows, goes further through the DNR so they can do the MST testing and different things. And we can have a full breakdown on that. That was not done on that particular property.
Thank you.
Mhm.
Any other questions? All right, then at this time, do I have a motion to adjourn the meeting? Motion from Jeff, a second from Kathy, all in favor?